One of my pet peeves is dentists who market to other dentists. I alluded to it a bit in our last podcast, but I want to give some suggestions on avoiding this problem in your marketing when we return. Unless you live in Dental Town, you're not going to get very far with content that would appeal to other dentists or only other dentists would understand. I think dentists' desire to do this stems from maybe ego or desire to have approval from their colleagues in their market area. Most dentists are afraid to talk in regular language for fear they will not seem like an expert. But seem like experts to whom? Most of your prospects have no idea what dental caries are, but they all know what cavities are. Some prospects may know what periodontitis is, but not many know. But they all know what red, puffy, and bleeding gums are. But Colin, those don't mean exactly the same thing. And I would answer, so what? The only people who would know the difference are other dentists, which brings me back to my point. Using big words and technical terms don't convince prospects that you're the expert. Diagnosing, explaining, and fixing their problem shows you are an expert. So what can we do to keep you from making this mistake? First, write to ease understanding. Our rule of thumb is to write at an 8th grade level to make sure that everyone can understand what you're talking about. There's numerous websites that can tell you the reading level of your copy. Just because someone isn't a good reader doesn't mean they aren't a good prospect. And if they are a good reader, they'll get through the copy much easier and be less likely to bounce off that page. Secondly, don't use dental jargon. Amalgam fillings are silver fillings. Extraction is removing teeth. Bruxism is just grinding. Occlusion is bite. Prophylaxis is professional teeth cleaning. Using these dental terms shows you're more concerned about looking smart than communicating with patients. Number 3, don't mislead. As I said last time, be as clear as possible. People are used to misleading marketing. What's refreshing is when content marketing is clear on the benefits and what it takes to get them. We're halfway through our series on using your website to convert prospects into paying patients. I hope you're finding it useful. Tomorrow, I want to talk about the benefits of your blog and other social media. Keep moving forward.